You've mentioned a couple of times about the 10% that aren't residents. Do you find, as this program is growing throughout the state, that there's referrals made from agency to agency?
That's the goal. Shauna mentioned the Jehovah Witness comment.
Nothing personal.
Nothing personal, but that was what was told to us by area police chiefs. They came to us and said, you know what, you guys are really making us look bad because we're not doing anything, and people are supposedly coming and saying, you know, we know that you're coming after us, and they're calling you the Jehovah Witnesses. And I said, well, thank you. We take that as a pride thing. So, you know, all of our overdose data, all of our run data goes to our county fusion center. So I said, you know what, I'm going to answer to that because I don't know that that's necessarily true. So I said, will you pull all the data for anyone with a Colerain address that overdoses in another city, town, village, township, and send those to me on a regular basis. This was probably June or July. Anybody want to guess how many of those have come back where our folks are going to other communities and overdosing? I got 0 so far. So actually our largest overdose numbers, I believe, is from the state of Indiana, outside the folks that live here, because we're 15 minutes from Indiana, we're 15 minutes from Kentucky. But that, when you talk about referrals, working with the state of Indiana, we've opened up and we've started talking through how we can provide cross-state referrals, because obviously they're coming over here. Let's provide them with resources in their own town so they can go back to Lawrenceburg or Dearborn County or wherever and start getting help. But in talking globally or regionally, as we've tried to explain to the local communities, it's not just Miami County up in, near the Dayton area. You got to look a little bit larger than just your county to the resources. Look at a larger scope, because we send people to Arizona. We've sent them all over the place to get the help that they need at the availability that they could get to, not just saying what's available within Hamilton County. We've sent them to Kentucky. We've sent them all over the place to get them the resources. But that's why these folks are so important. So, I mean, it definitely is thinking bigger than just ourselves.
Like Dearborn Hospital will take Ohio Medicaid. I mean, so you try to learn all those loopholes and then just try to hold on to people until you can get them someplace. It's, I can't act like it's always easy. We're there too to get rid of these obstacles. Sometimes it may be as simple as they don't have ID, or they don't have a birth certificate, or they have other medical issues. We had a woman recently who didn't want to go to treatment until she had her Social Security disability hearing. So there's a lot of things sometimes that are obstacles that we try to work through with people.
Well, she brought up an obstacle that I didn't know, didn't even cross my mind. It was IDs and birth certificates to move through the process. I found out that these guys were taking money out of their own pocket between our officers and our medics, and Nan, and paying the fee to get the ID, paying the fee to get the birth certificate. So what we did is for the law enforcement side is we used what we call our criminal pursuit fund, our funds associated with using drug transactions and buys and doing that. And we were able, through our law director, says you can take funds and then under the same use system. Like if we got a donation from Walmart to support the QRT, $2,500. I put that in that fund so they can buy a meal to somebody that hasn't eaten. They can buy that ID card, they can get that birth certificate, so they can move forward and get registered for Medicaid and do the things we need to. Because we never even thought about how that might apply until they were spending their own money. So again, different way, but we use donated money, put it in the system. Again, the policy change, it's there. It's recorded the same way, it's audited the same way. It's just another hurdle that we were able to cross through.
I've said to a couple of you, and I'll be glad in the future, we were willing to take some risks and be flexible. There are ways to pay for this through some of your traditional dollars. It's not as expensive as you think. So, when it comes to trying to figure out the budget stuff from a provider standpoint, we're really glad to help you.
You do. We're recording it.
Oh.
Yeah, so everybody can hear you, but we are recording it, so thank you very much.
I just wanted to know, since you guys did say you answered
one question already, which is you guys will send out of state. I know for our county, it's difficult. There's an extended wait time for some of the beds, and sometimes you can get somebody out of state overnight. So do you have a percentage of the number of people you guys deal with out of Colerain that would be going out of state, that you guys have placed out of state, or is there a
I
percentage?
can run those numbers for you.
Okay.
I can't say it's really high, but we have done it. We were fortunate that a provider opened operations in Colerain, I think partly because Colerain's a treatment recovery friendly environment. We worked very closely with him. And then as provider competition got a little bit going, they started to step up. It's like, well, we're referring to this place because they'll take our people right away. And so, you know, it's, I, as a provider, know it's a challenge. You need staff to open up additional spaces, but sometimes the process for getting into care is unnecessarily cumbersome. So Shauna and I, having lived through it, have been able to give some feedback to providers. I usually do it CEO to CEO because I don't want to hurt anybody's feelings, but most CEOs do not know what goes on in the day-to-day. You think it's easy to get help at your place, and if you actually tried to get help, you'd realize that, no, it's not. So, yeah, it's kind of, yeah, you just kind of try to work this as you can.